Good morning. We have a special guest for our coffee grooming. Thank you for honey.
Honey or funny?
Funny.
Yeah,
Funny.
that's
So good morning again. I think this is episode 5. This could be episode 5.
Yes.
I have a very special guest this morning. Amelia. Amelia. What's your name? Where do you come from?
I'm Amelia and I'm from Tetbury.
Who are you? Who are you in this coffee groomers circle?
I run the tech pet shop.
Yeah.
Yeah. You want me to elaborate?
Yeah,
Do you know what else I do?
You're the boss.
Yeah.
You're in the pet shop.
Okay.
Half of it.
Yeah.
Yeah.
With you.
Yeah. This morning I thought we could talk about, and spring it on you guys, teeth cleaning, because we've been learning a lot more about it. There's a lot more appointments being booked up with teeth cleaning.
Yeah.
I thought it would be really cool to go into a bit more, explain why it's good, how we can use it to prevent vet things and just prevent problems essentially.
Yeah.
Okay. Cool.
So
And why is it such a needed thing, I guess?
yeah, why is it needed? And I guess we hear a lot of people, well, I see a lot of people on social media and lots of people come in saying they've taken their dogs to the vet and it's been really expensive and they have so many teeth removed. So what can we do food-wise in the pet shop and also upstairs to help prevent that?
Cool. That's quite a good subject.
It's a good subject.
Yeah. And
So-
it's Dog Dental Awareness Month.
Is
It
it?
is, yeah.
Yeah.
There
Really?
is dog dental.
I
awareness.
see
Yeah.
these things just
Happen.
happen.
Don't know where they come from. Don't know
Do you
why
want to come
they
yesterday?
Yeah.
So we offer two types. Sorry, excuse me. We offer two types of teeth cleaning, don't we?
Yes. Yeah. Manual and ultrasonic.
Yeah.
Yeah. So the manual is literally just toothbrush and some lovely tasting toothpaste.
I tried it, it's horrible.
Yeah. It's pretty bad.
Mhm.
And
Salt.
it's just is baking soda
Mhm.
and supposed coconut oil just tastes of baking soda.
Is it like the Arm & Hammer? Is it Arm & Hammer or something?
It is,
Oh,
yeah.
yeah, like times 10.
Is it a special dog one or is it?
Yeah, I
Yeah.
mean, you could
Okay.
use it on people too. There's no ingredients that you
Mm.
couldn't. It,
I
it
don't
just
think they'd
tastes
like it.
horrible. Yeah, yeah. The dogs seem
Salty.
to like it. We really don't. Yeah, it's
I
not
guess
good.
it's just without the sugar, right?
Yeah, yeah. Without sugar, in it. Yeah, because they can't put xylitol in it. 'Cause
Yeah.
that's allergic to xylitol. So yeah, they have their teeth brushed for a good 10 minutes. Just on the manual, trying
Yeah.
to get some stuff off the tooth surface, or just get them used to it and desensitize them to the process. And then with the ultrasonic, you don't brush their teeth per se with it. You're meant to hold the bristles on the tooth surface for like 20 to 30 seconds for each tooth. And then in doing that, the ultrasonic waves with the toothpaste, it has to be the EpiPet toothpaste.
Why that
Creates-
toothpaste?
It's something in the formula. It creates
You're on the spot.
nanoparticles, or micro nanoparticles, one of them, that help to penetrate through the plaque to help to lift the plaque away from the tooth surface. So over time, with harder dental chews, food, bones, that kind of thing, the idea is at home the plaque and tartar should be able to lift away, and also when we use our tools we can just flick it away from the tooth without having to apply pressure or, you know, make the dog
So it's like a gentle thing, it's not abrasive or anything.
No,
No.
it's not abrasive. It's completely silent. There's no vibrations to it.
Is that like a last resort thing, or is it something you'd recommend doing
I think the earlier you start it, the better. Just because it helps
on both
to,
the manual or the Emmys?
well, on both of them. I think if you've got a puppy, it's really important to start brushing their teeth, even if you just have like a bit of bandage on your finger and just brush their teeth with it.
What do you mean, like bandage?
Like a plaster.
Like a plaster?
Yeah. Like, what happened to you?
Pick.
You're on jail with them.
Yeah.
Yeah. Yeah. I tried that too, actually. But yeah, you can use like bandage, anything that's slightly abrasive, even just human toothbrushes, the silicone toothbrushes, anything just to get them used to having their mouth handled. It also makes you aware of how your dog's mouth should look,
Mhm.
what a normal gum colour is for them, tongue colour, tooth colour, if they've got any plaque build-up.
I guess
if
it's
their
just the
teeth
same
are
as what
aligned.
you're doing. Like you're more aware of seeing the dog regularly up close. Like it's
Yeah.
just getting the owner to be aware of what their dog should be looking like, what their breath should be smelling like, and it's just noticing then if anything changes.
It's exactly that. It's just keeping an eye on everything.
Yeah.
It just helps the future. Like, say if something happens to your dog where their blood sugar is really low and you go, oh God, I've got to check their gums. If you don't know what their gums are meant to look like, how are you meant to tell if they're pale or if they're redder
Yeah.
or like anything going on? But yeah.
Does every dog need its teeth cleaning, or can it work with food and diet? Is that part of it, do you think?
Yeah, absolutely. Food and diet really play into it. Typically speaking, a lot of chews by big companies that are aimed as...
We can tell people,
Oh,
don't
we can.
eat Dentastix. They are terrible.
Yeah, they taste really bad. Humans don't
They
do
are.
it.
They're not
you know?
terrible.
They are, yeah. And the
You've written in blog
yeah,
articles
it's
that they are
extremely
awful.
irritating because on a packet it says to give one to your dog every single day.
Yeah.
And it's just oil, and that oil and cereals and sugars coats the teeth in plaque. So you'll actually see an increased build-up in plaque if you're using them.
Yeah.
Which is a great sales tactic.
Well,
So
it's
you give
also
them more.
very confusing, yeah, because you're like, surely this can't be the Dentastix that I'm introducing, which is why, as well, I think it's good to keep food diaries, but also to know
Yeah. What
the
to look out for.
differences. Yeah.
Yeah.
So looking at your dog's teeth from the beginning, and then you can kind of think of a trigger point.
What would be a better alternative to a Dentastix? We're not scientists or vets, so don't take our advice seriously. Well, do take our advice seriously, but we just use common sense, and I suggest people do the same thing.
Yeah.
So not make any claims. What would you suggest would be better?
Raw bones, if you're comfortable giving them marrow bones. I kind of think of it like, can you use the word abrasive, or is there a better word to use?
So I don't know if abrasive is the right word. Like I always say about raw bones, because there's so many different layers. They're like interdental flossers, because they really encourage dogs to use all of their teeth, and especially their front teeth. But I don't know if abrasive is.
Because I'm
it's
thinking
not
of it
abrasive, but it's
a bit like a scouring pad on something that's dirty.
Yeah.
There has to be some kind of scratchy
The movement or
Yeah.
something, yeah, like that.
for it to come off.
Just like a bristle of a toothbrush is brushing against the teeth, right?
Yeah.
Same with our teeth.
Yeah.
It's like a little bit of friction, which is...
Yeah, sometimes you just need a slightly harder chew, so when they crunch into it, it really does dislodge the plaque. Yeah.
Mhm.
So things like yak chews, raw chicken, if you're raw feeding, raw chicken wings are great for that, or in chicken carcasses.
Carcass, yeah.
What else?
Marrow bones.
Yeah.
Just anything that's hard.
But so, for
Literally
example,
anything.
it doesn't mean if you just feed them all of that and raw food as well, it will just solve the problem.
No, some dogs are more prone to it than others.
Yeah.
Typically speaking, like your brachycephalic breeds, which are like pugs, bulldogs,
The flatter faces.
flatter faced
Yeah.
breeds, because their teeth are a little bit crammed in there, they do tend to suffer with dental ailments sooner than other. Quite a lot of times as well, their teeth can be misplaced, so it could be a case of their two front teeth will grow into each other, or the same with their molars to their canines. Like, it can be really uncomfortable. But like your sight hounds, anything with like a really long snout suffers quite a lot. Chihuahuas, I'm trying to
Small
remember
breeds.
the skull
Some
type.
breeds. So the
Small
longer
breeds.
breeds, because they've got a longer
Tiny.
mouth.
Yeah,
Yeah.
yeah, longer mouth. Out of all of them, I don't know if it is just the longer mouth, but the amount of greyhounds and whippets we see that they are regularly having to have teeth out.
Tiny.
Maybe it's because they are more commonly fed like wet food. If they're a bit
Yeah.
fussier, like small breeds are quite fussy as well, and wet
Yeah.
food is notorious with plaque
Build
build
Yeah.
up.
Nothing to scratch it off.
Yeah.
Yeah.
Sorry, every
Do
single
that.
one of our freezers is deciding to cool down at the moment.
They're very noisy.
They're now all off.
Okay, so thinking from a puppy stage, a medium-sized dog, and a later dog stage. Puppy, start getting them used to having something brushing their fingers.
Yep.
And then ultrasonic or not ultrasonic for puppies?
To be honest, it doesn't really matter. Like, ultrasonic is great because it does kill all the bacteria in their mouth.
Okay.
If you start it when there is no plaque buildup, it will really help to prevent any plaque from like clinging onto the tooth surface.
Yeah.
So I would say if you can do.
Yeah. Just get that as
if
a
you
regular
can't,
thing.
then
And then,
wait.
so from a puppy, how many times a year, or would it be a yearly thing?
Twice a year.
Twice a year.
Twice a year for a pup.
And then it's
Quite
just keeping them on
often-
top of it as well.
Yeah, and then as they reach adolescence, I'd probably say once every 3 months, just to keep on top of it. Quite often we see like 1.5-year-old, quite often spaniels actually, I don't know why, that when you look in their mouth, they have loads of build-up, and I can't explain it. I don't know where it comes from, how it gets there, but for such young dogs, it is really odd to see.
Because they never had their teeth brushed.
Yeah. Or you don't know
Yeah,
when
and I
they're
guess
fed, or
working dogs, so people are maybe a little bit more blasé about the dog. Maybe it's not their baby as such. I mean, every dog is everyone's baby, but there's different variations of that, especially now. Like it can be very intense, and it can be a bit more.
Yeah, dog's a dog,
normal.
out in the
Yeah.
garden.
So-
off you go.
That's interesting. So if you say there's a lot of plaque build up, at that stage, people might be like, "Oh my god, my dog's teeth are covered in plaque." Should they panic?
A little bit, yeah.
Okay.
If I'm being completely,
Yeah, okay.
not to scare anyone. But you do have to be careful. Like, as soon as you start noticing like discoloration of the tooth, it's not necessarily that really hard plaque. It can be staining. Like, something's not quite right. So either it's an imbalance in what food they're having in, if there's additional growth of bacteria in their mouth. Sometimes, it's diet, it's lifestyle, it's everything. And if you notice it from the age of 1 to 2, really stay on it, because it could literally be in a matter of when they're 4, they're having to go under to have their first.
So at that
scale.
point, should they come to someone like you, or should they go to the vets?
At that point, I would probably, if they're due a checkup, it does no harm to talk to the vets to go through different things, what you're feeding them, what supplements, that kind of thing. Pop into a pet shop like here, where you guys are knowledgeable on what chews to have or what to feed them or stuff like that, and then go to your groomer. If they offer teeth cleaning, have a little consultation, have a good look in, and see what you can do to prevent it.
Yeah, and I guess it's just getting a first, like, obviously we offer a free consultation, so you just have a quick have a look, and then you can assess, okay, maybe that's something we can work with, or no, you can recommend something else,
Yeah.
which is a better thing maybe.
Yeah, I think the scariest thing for a lot of people is having the dog go under and then having a lot of teeth out, because it's not always just one, it's usually like up to 10.
Okay, so let's move on to that. So
Extreme.
going to the vets to have teeth work done, what does that involve?
So they have their pre-op, which obviously,
And to be clear, they always go under or not? Most of the time?
I'm to the best of my knowledge, they always have to go under.
Okay.
I think it's a safety precaution as well, because they've got like electric tools to remove the plaque and tartar. They need them to be put under, so they're not thrashing their head around or moving their tongue about, that kind of thing.
Okay, which makes sense.
Yeah, I'd probably want them to be asleep.
There's not really any understanding with a dog. You can't tell them what's going to happen. It's going to be okay. So.
Yeah, please keep your mouth open.
Don't panic.
Yeah. But they will go in, and then obviously can't feed them for the full day. I think they're usually in the vets for a minimum 6 hours, I want to say, because obviously they have to be put under, have the deep scale and polish. If they need to have teeth extracted, then I think they need to have their gums sewn up. I don't know if it's different from humans. I've never heard about their gums, but I take it if it's like a bunch of teeth, you would want to have
be a hole.
some sort of padding. Yeah. And then obviously it's the aftercare afterwards, so it's them coming off the anaesthetic. It's the, okay, what do we need to change in their food? Do they need wet food? Like, I guess there's a lot that goes into it.
I guess it's making sure we can prevent that from happening, and it is possible to prevent that from happening.
Yeah.
Well, those teeth won't grow back.
No.
So once you've got to that stage, there isn't any repairing it.
No.
And we have one dog who comes in and he's had 30 teeth out. Lock.
Oh yeah.
Yeah.
Bless
and now his tongue just hangs out his mouth because he can't. There's nothing holding anything in.
Canines, hasn't he?
Yeah. He just has 2 canines and that is it.
Yeah.
And again, all of these things are generally preventable as well.
Yeah. Like obviously, as they get older, it's just dentistry. Sometimes teeth will have to come out.
Yeah.
But the idea of the preventative is to prevent how many teeth having to come out, and also as soon as you start to notice something malicious going on in the mouth, whether it's an infection, is treating it as soon as possible and just making life less stressful for your dog is the main thing. There's so many dogs that have quite bad separation anxiety that actually going to the vets for 6 hours can be really stressful. No matter how good your vet is, that's not a dig at vets at all.
It's just a stressful experience.
Yeah.
So better to be preventative, keep an eye on your dog. So your top tips, I like Jordan's top tips, would be just check your dog's mouth. Just learn to get your dog comfortable with having the mouth checked. You can then notice anything changing. You can then see, okay, maybe there's a bit of plaque. Perhaps we can work on that first before anything else happens.
Desensitizing them as well to having their mouth touched is pretty important.
Yeah, and it's never too late to try. Like even if your dog's 7 and the teeth are in need of something, it's never too late to start brushing them at home or switching their diet or getting them chews. Like,
I've got 2 major products: the seaweed plaque powder, Irish seaweed, and coconut oil.
Yeah, fantastic.
what is
inexpensive.
the seaweed?
Great.
Do you want to explain what seaweed is?
The seaweed you just put on top of food and it gently breaks down plaque.
Yeah. So
But it works over time, so you
Yeah.
use it daily.
It's not an instant thing, is it? It takes about
No.
6 weeks.
6 weeks to notice the difference, yeah.
And it's
But it's a bit like, I guess, the Pet toothpaste in that
Yeah.
it works with the plaque to get rid of it.
To break it down.
Yeah.
Breaks down the plaque, doesn't it?
Breaks it down, yeah.
And then the coconut oil is very good for the breath.
It's breath, oral health. Again, it's antimicrobial, antifungal, and antibacterial. So it just works great, and it's also really good for their skin and generally
It's
health.
great stuff.
Everything.
It's good stuff.
Yeah.
That you can use as a toothpaste, really.
Yeah, you can
Yeah.
use it as
You don't need
toothpaste.
to buy one.
Yeah, you can literally just put, depending on your dog size, tiny bit in their food.
Yeah.
It's really nice stuff.
Amazing. That's our 15 minutes up. We got to open the shop.
Oh, cool.
Thank you.
So,
Amelia, how was your first coffee with Groomers?
Great, thank
Do
you.
you like it?
Could be
You
longer.
Could be longer. Or we
Yeah.
got it's a short
Still
one.
have so much to say.
So yeah, top tips: seaweed powder, coconut oil. Maybe speak to your local groomer, so if they do a consultation, and then inquire about some ME tooth.
Pet.
Yeah, you've got like two big brands in the ultrasonic teeth
Yeah.
cleaning, which is Pet and Cleany Teeth.
Yeah.
The only real big difference is Pet have patented where the ultrasonic chip
Oh, yeah, I remember you
is
saying.
in the toothbrush head. So they've managed to get the ultrasonic chip as close to the bristles out of all the other companies. So it does tend to be the most effective
Yeah.
of the ultrasonic cleaners. But I've used Cleany Teeth and they're great as well.
Perfect. Cool. So yeah, if you've liked this, we're now on Spotify, YouTube. Please like; it really helps us a lot. Subscribe; it would also mean a world for us building our channels. If you've got any questions, let us know. Or if you've got any topics you'd like us to discuss. That came out
we
clearly.
can do that. Yeah, no, that
I think so, yeah.
That came out
that was
clearly.
correct English.
Correct English, great. Yeah, we'll see you on the next episode. Thank you very much.
Bye-bye.
Bye bye.
Happy teeth clean month.
Oh yeah.